Autism, also known as autism spectrum disorder, is a neurodevelopmental disorder that affects communication, social interactions, and behavior. Medical experts say the precise causes of autism are unknown in most individual cases. Research shows that the disorder is highly heritable and polygenic, and neurobiological risks from the environment are also relevant. What is responsible for this disorder? How can it be prevented and managed? And what are the response mechanisms in place for care and support? These are some of the questions my guest, Dr. Ruben Ajeni Ikakpe, Coordinator, Early Intervention Center, Ike Foundation for Autism, will respond to on this segment. Thank you so much for joining us on the program.
Thank you for having me, ma'am.
All right. So let's begin with a bit of education. What characteristics are there in this impairment?
So for autism spectrum disorder, it is characterized by deficit in social interaction, deficit in behavior, and deficit in communication. For example, the developmental milestone for a child is like 2 years old. The child is supposed to be able to talk or say at least a word.
A few words, yeah.
So if you notice that your child is not saying anything at the age of 2, then it could be autism spectrum disorder. Then in terms of social interaction, children like to play around with each other. So if you put your child in a group of kids and you notice that your child rather wants to stay alone, then you should go for a checkup because it might be autism spectrum disorder.
Okay, what about physical appearances?
So in terms of physical appearances, it's not necessary that you can tell from just looking at a child if the child falls under the spectrum. Because as the name implies, it's a spectrum, and some children might fall on the mild part of the spectrum, the mid part, or the severe part of the spectrum. So for kids on the mild part of the spectrum, you can't notice by just looking at them. But for kids in the mid and severe part of the spectrum, you can know this by the lack of eye contact in the children. For example, a child on the severe part of the spectrum may not be able to maintain eye contact with you while speaking to you or while trying to interact with you. So instead of looking directly into your eye, they will just never look into your eye. Then in terms of physical behavior that you can tell, they often showcase repetitive movement. For example, the flapping of hands and rocking, moving to and fro. So for example, when you see a child excited and in this excitement, the child keeps flapping their hands repeatedly as if they have no control of that, that could be an indication of ASD in the child.
And the child. You know, oftentimes doctors would say causes are not known. How is this possible? Or better still, why?
So in the medical space right now, in the medical research space right now, we can't say for sure this is the cause of autism, but most people would hypothesize that it's a combination of genetic factors and environmental factors.
Okay.
It took us human beings a long time to start recognizing the genes we have in the body. It took us even a longer time to sequence the entire human genome. So right now, doctors say we don't know the cause because we can't tell you this is the gene that codes for ASD in a person, or this is the gene that was passed on from the parents to the offspring in the child. However, with research, we can see that environmental factors such as taking improved seedlings or ingesting improved food can lead to mutation in the gene of the parents that's not passed on to children. So there's no definite cause of it yet, but very soon, I'm sure research will show the exact gene that codes for ASD in children.
Okay, now let's talk about pregnancy. And I'm bringing this in because, you know, when a woman is pregnant, they tell her, don't do this, don't take that. You have to live this particular lifestyle. You have to drop some habits and all that. Could these factors be responsible? Smoking, drinking, or a fall, something
Yes,
environmental?
So when I said genetic and environmental factor, the pregnancy period is very, very, very important for the child. Prenatal and postnatal period, very, very, even during pregnancy, it really matters. We've seen cases where hypoxia is the term used when there is low supply of oxygen to the brain, to the child. So when the child is giving birth, so just the situation that I was saying was the umbilical cord tangled with the neck of the child during delivery. And that was what we could define as the cause of ASD in that child. So your lifestyle during pregnancy really matters a lot. So in terms of smoking, drinking, even treatment of infection during pregnancy should be closely monitored by your physician, because the type of antibiotics you use even matters during, the type of painkiller you even take during pregnancy matters. So yes, it is a factor, and before you take any medication or engage in any lifestyle change, it needs to be addressed during pregnancy.
During pregnancy.
Yes.
Now let's talk about the types we have. Let's educate or enlighten Nigerians, mothers especially, about these types of disorders.
Okay, so when you say autism, you're talking of one particular neurodevelopmental disorder, which is autism spectrum disorder. There are other types of neurodevelopmental disorder, and usually when a child is diagnosed with ASD, autism spectrum disorder, it comes with a comorbidity. A comorbidity is a disorder accompanying this autism spectrum disorder. Examples of such comorbidities are ADHD. ADHD is attention deficiency hyperactivity disorder. Okay. When seen in a child, the child is unable to focus on a particular item, or the child is more active than their peers. That's when the child comes into a space, it's difficult for the child to sit at a particular spot. So ADHD is broken down into two. There are two parts of it. That's the attention deficiency part and the hyperactivity part. In some cases, you might see it happen as a pair, and sometimes it happens as one part, which is attention deficiency, and the other part, hyperactivity. Another comorbidity we could see is the global developmental delay. This is certain behavior, certain delays that you can see in a child. This is when a child does not meet their developmental milestone. For example, a child that is 6 years old today is supposed to be in, let's say, primary 2. And unfortunately, in the schooling system, in the mainstream school the child attends, the child cannot just pass the cognitive level test given to them. So this can be categorized as a global developmental delay. So there are many neurodevelopmental disorders apart from ASD. There are cases like cerebral palsy, Down syndrome, but we don't want to go into the depth of that because we are focusing on autism today.
Of course. Now, you work at a foundation. In managing this disorder, how has it been like?
The best we do is we provide different types of therapy for these children. The plan is to provide this therapy to teach them certain behaviors, certain skill sets, so that at the end of the day, they can be integrated back into society as if there were nothing wrong with them. For example, we do cognitive therapy. Cognitive therapy is used to bridge the gap in academic performance of the class, Under cognitive therapy, we do numeracy, literacy, arts, and sciences for the child. So we teach this child the basic things they need to know in an academic setting. So the mistake is when a child just goes to a mainstream school without doing this, it's hard for the child to understand the basic concept of these things. So we try to teach them the basic concepts of it. Then after cognitive therapy, we do behavioral therapy. So this disorder comes with many challenging behaviors like tantrums. The child might just want to be able to communicate something. The inability of them being able to communicate that thing to you makes them throw a lot of tantrum. So we do behavioral therapy by doing calming techniques for the child to make sure they don't do this often. Then we also have occupational therapy, we have speech therapy, and we have sensory integration therapy. We do this as a full, like a holistic approach. We don't take in the child and just do one aspect of therapy for them. We make sure we cover the entire aspect of the child. To make the goal in the center is to make sure we can integrate this child after spending, let's say, 6 months to 1 year with us, back into the society.
Okay. Now, you talked about integration, and then, most times some of these children are brought in at a very tender age into the foundation or a particular home, because I've been to many homes. They grow up to become adults, teenagers. How do you handle teenagers? Because so many things happen between 13 and 18.
Yes, ma'am. So in terms of handling teenagers, we operate with an individualized educational plan in the center. Unlike mainstream school where you have a teacher teaching a group of students, we don't do that at the center. So regardless of the age of the child, we do an assessment for the child. If the child is a teenager, we would have a therapist assigned to that child. And the therapist doesn't just teach randomly. The therapist teach according to the individualized educational plan for that particular child. So regardless of the age, the therapist would be able to teach new behavior, new cognitive skills, and occupational skill for the child. That's the guiding principle for all that we do in terms of providing care for people on the spectrum. So according to ABA, there is a clear rule that states that a male therapist handles a male child,
Okay.
and a female therapist handles a female child. So we, in our center, we try to make that rule play out very well. So in terms of age, there might be some disparity in terms of age. For example, in our center, we have some female therapists handling maybe a male child that's 2 years old, that's 3 years old. So if the child is very young, from the age of 2 to 4 years, then the female therapist can handle a male child, a male therapist can handle a female child. Okay. But once they pass the age of 5, it's gender specific.
Okay.
A male therapist would handle a male child, and a female therapist will handle a female child. And this is very important because most of these kids haven't developed the skill they need to even use the restroom. And these kids learn from modeling. For example, if I'm trying to teach a child how to use the toilet properly, I would have to use the toilet for the child to see me using the toilet and copy what I'm doing, so that when the child is in the toilet next time alone, the child can remember that, oh, I saw Dr. Ben doing this, so and just do exactly what I did.
Okay. Okay, now let's talk about management. This disorder, can it be treated over time or with years?
That's a very interesting question. You know, most parents always ask, when will my child get better? When is this going to be over? So unfortunately, there is no cure for ASD. There's no medication you take today and you leave the spectrum. It can be managed with therapy. We have seen many cases where a child comes into the center, develops a skill, maybe in music, maybe in mathematics, develop a particular skill, and this child goes on to do great things in that particular field of study the child has developed interest in. So it's not something that you can cure, but it's something that can be managed to make sure that the child lives the best possible life for them. The advice I would give out to parents out there that have children diagnosed with ASD is to seek for help.
Okay.
Seek for professional help. Do not keep quiet. Do not hide your child. There are many times we've been called into a setting where we see that the child is just locked in the room without access to any care. My advice would be for parents to always seek for care. Then you'll be referred to the appropriate authority. Thank you.
Dr. Ruben Ajani Akakbe, I want to thank you so much for joining us on Insight this week. Thank you for enlightening us. Thank you for your words of encouragement to parents out there with these children. Thank you very much.
Thank you for having me. Thank you.
Thank you.
And that's it on this episode of the program. Do join us same time next week for more on Insights. My name is Nnamdi Odikbo.
And I'm Elizabeth Omori. We'll see you next week. Stay safe.